Now we get to look at another aspect that has to do with all these artificial implants to handle joint issues, and this is the prosthetics, okay, or they say prosthesis. Okay, so you're trying to implant them, and after you implant them, one of their side effects is if they're not managed properly, they could result into infections. Okay, so you can see this prosthesis. I'm putting an artificial, man-made bone. It could be plastic, it could be metal or so. So you just simply it could be called what implant or prosthetic infection, or what periprosthetic what infection. Peri because it occurs around the artificial replacement. So it's just a complication of joint replacement or other implants medical device, and now you are having infection by microorganisms like the Staphylococcus aureus. Most of the times they are now colonizing the implant surface, okay, and all of that. So you say that it's an infection that followed an implant medical device. Now several reasons could actually be causing it, right? It could be joint replacement, or it could be cardiac device, or any of those things. So pathogenesis. Staphylococcus aureus and Staphylococcus epidermidis, they are the most common microorganisms that usually cause this issue. Okay, sometimes gram-negative bacteria or fungi may also be involved. Alright, so they form biofilm, so they now adhere to the implant surface. Okay, they form like a congregation. That's usually what makes them resist antibiotics. Right, so roots of infection, they could be introduced during the surgery. Okay, it could be that there's an infection elsewhere, so it was now spreading through blood. It could be local tissue compromise. So clinical features is a lot of pain, a lot of swelling, a lot of warmth, reduced function of the prosthetic joints, sometimes systemic issues like fever. So you diagnose it from all those laboratory tests to measure the inflammatory markers, imaging, that's all those x-rays, microbiology, we are trying to aspirate the joint fluid, and also tissue cultures. Right, so management, you give antibiotics, just to handle the issue. So you try to actually identify the microorganism involved, and you give antibiotics as what it will be effective on it. So you can also debride if there are some dead tissues around there. Then sometimes they can do a revision arthroplasty. Sometimes if it's getting severe and nothing is actually resolving, you might actually just need to remove the prosthesis.